The outbreak of bird flu in a turkey farm in Suffolk is the news we've all been dreading. Bird flu is in Britain. But is this really a cause for concern? Well, with me I have Dr. Hilary Jones. Doctor, how worrying is this?
Well, we've had bird flu in Britain before. The difference here is that this particular strain is the H5N1 strain, which is very potent and kills lots of birds. It is also the strain that has been responsible for a very small number of deaths in humans in other parts of the world, and therefore it's even more important we contain this outbreak. But I think all the contingency plans that have been prepared and put in place should protect us completely.
How dangerous is this to humans?
Well, to humans at the moment, not at all. It's of negligible risk because this is predominantly a disease of birds, and it only transmits to humans with great difficulty. And in the past, we know that it's only transmitted to humans who are in very close proximity to infected or dying birds, and that simply isn't the case in this country.
Now, people will be worried, of course, about eating poultry. How safe is it?
Well, it's perfectly safe to eat duck, to eat turkey, to eat chicken. Our food chain is very carefully protected and monitored, and we're very safe. And if you enjoy those foodstuffs, you should continue to enjoy them, because let's not forget that poultry is lean meat, it's nutritious, it's low in saturated fat, very versatile. And if people want to be doubly safe, they can go for the red tractor logo, which means that we can trace it back to independently monitored farms. We can go for the quality turkey British logo, and that gives us extra assurance. But even if, and this is a huge if, we were to eat meat that had been contaminated by avian flu, we would still be safe, because as long as you cook it in the normal way, the virus is heat sensitive and completely killed by cooking.
Now, we do hear people talking about the dangers of a pandemic. What are the risks here?
The risks, I think, are the same as they have been for the last 80 or 90 years. Everyone talks about the pandemic of 1918, but we're not absolutely sure that was an avian flu that had transmitted to humans and become passable between one human to another. So the circumstances that have been there for many, many years and even decades are still there today. So we haven't had a pandemic yet. People are talking it up. Theoretically, statistically, there's a small chance, but it's a very small chance, and hopefully we will never see a pandemic. But even if we do, we've got antiviral medicines available to us. We can prepare vaccines, we can isolate patients, we can treat secondary infection with antibiotics. So the world is a very different world now in 2007 compared to the pandemic world that we had in 1918.
And finally, are there any kind of general changes to lifestyle that families could make?
Well, I think one of the risks that we do need to bear in mind is the risk of picking up the virus from wild wet water birds, migratory waterfowl. So if you're taking the family down to the duck pond to get the children to feed the ducks, then clearly you don't want the feces of wild birds where the virus could be transmitted on your shoes. So before you come into the house, take your shoes off, wash your shoes, wash your hands. These are reasonable precautions that I hope people would be thinking of taking anyway.
Dr. Hilary, thank you very much.
Thank you.